Hi guys, welcome to my YouTube channel. My name is Dr. Achievement and today I'm going to take on the topic hip joint anatomy. So then I asked myself, what is hip joint? In this topic, I'm going to be covering introduction of hip joints, joint articulation, ligaments, muscles, and nerve supply. Let's begin. Hip joint is a ball and socket synovial joint formed by an articulation between the pelvic acetabulum and the head of femur. It is a connection from the lower limb to the pelvic girdle and thus is designed for stability and weight bearing rather than a large range of movement. Articulation. The articulating surface consists of articulation between the head of femur and the acetabulum of the pelvic. So the acetabulum is like a cup-shaped depression located on the anterolateral aspect of pelvis. The ligaments. The ligaments of the hip joint act to increase stability. They can be divided into two groups, intracapsular and extracapsular. The intracapsular ligament is the ligament of the head of femur. It is relatively small structure which runs from the acetabular fossa to the fovea of the femur. It encloses a branch of the obturator artery, a minor source of artery supply to the hip joint. Extracapsular ligament. The artery main extracapsular ligament continues with the outer surface of the hip joint capsule. Iliofemoral ligament arises from the anterior inferior iliac spine and bifurcates before inserting into the intratrochanteric line of the femur. It has a Y-shaped appearance and prevents hyperextension of the hip joint. It is the strongest of the three ligaments. Pubofemoral spans between the superior pubic rami and the intertrochanteric line of the femur, reinforcing the capsule anteriorly and inferiorly. It has a triangular shape and prevents excessive adduction and extension. Ischiofemoral. It spans between the body of the ischium and the greater trochanter of the femur, reinforcing the capsule posteriorly. It has a spiral orientation and prevents hyperextension and holds the femoral head in the acetabulum. You can appreciate from the picture at the anterior view we have the iliofemoral ligament and we have the pubofemoral ligament, whereas in the posterior view we have the ischiofemoral ligament. Neurovascular supply. The artery supply to the hip joint is largely via the medial and the lateral circumflex femoral arteries. Branches of the profunda femoris arteries. They anastomose at the base of the femoral neck to form a ring from which smaller arteries arise to supply the hip joint itself. You can appreciate in this picture the medial circumflex femoral artery, the lateral circumflex femoral artery, the femoral artery, and you can appreciate other profunda femoris artery. Movements and muscles. What are the movements of hip joints and what are the muscles responsible for this movement? The movements that can be carried out at the hip joint are listed below, along with the principal muscles responsible for each action. Flexion, iliopsoas, rectus femoris, sartorius, and pentineus. Extension, gluteus maximus, semimembranous, semitendinous, and biceps femoris, which are also called the hamstrings. Abduction, gluteus medius, gluteus minimus, piriformis, and tensor fasciae latae. Abduction, adductor longus, adductor brevis, abductor magnus, pectineus, and gracilis. Lateral rotation, biceps femoris, gluteus maximus, piriformis, assisted by obturator scamali and quadratus femoris. Medial rotation, anterior fiber of gluteus medius and minimus tensor fascia parti. Thank you for watching this presentation. If you're looking for a very good anatomy textbook, there's a link in description with some percentage off. Have a very nice day, guys.